Steve, and this is Jamie, my patient. I'm just going to go through a cardiorespiratory assessment with Jamie today, just because he's been having some problems with his breathing in his lungs. So we're just going to go through, make sure everything's symmetrical, and just see if there's any problems with build-up or fluid or anything around his lung cavities. So first off, in a cardiorespiratory assessment, we just look at our patient, just ask him to breathe nice and normally, not tense quite as much, and just relax on the bed. Okay. So just breathe nice and normal. I'm just going to make sure that there's not too much accessory movement. Stomach's breathing quite well. It's absolutely fine. Nice to do a few deep breaths for me as well. That's it, in through your nose and out through your mouth on this one. And we're just listening for anything or any particular reactions that Jamie gives us. And that's quite normal and relaxed. Do them back to normal way, it's fine. Great. Okay, just come around the back as well. What we're going to do now is just check that his chest expands evenly on both sides. So for that, what I'm going to do is just put my thumbs roughly about a centimetre either side of the spinous process around the chest. Just ask Jamie to breathe nice and normally, and my thumbs should move at about the same distance on either side, which they do. Good. And relax. And we do the same on the front as well. So roughly here, just nice and relaxing and just breathe normal. Good. Good. That's it. So nice and even, which indicates no problems with one side less than the other. What I'm going to do now is just check Jamie's trachea as well, just to make sure that there's no deviations in it, because that can obviously cause problems with airflow. So just very nice and relaxed. I'm just going to touch your throat here, mate. So I'm just going to, nice little palpation, just make sure that it's nice and straight and even. And it's absolutely fine, obviously, because Jamie's not a proper patient, but that's absolutely fine. So next we're just going to do a vocal therapist check. So all we're going to do is just ask you to say 99 over and over again, just nice and clear. I'm just going to put my hands about here on your chest, and all I'm looking for is just any phremesis that happens that we feel here when Jamie's doing this test. So just say 99 for me over and over again. 99, 99, 99, 99, 99, 99, 99. And relax. So perfectly even on both sides, no drops, anything like that. It's just perfectly even. So this is, I'm just going to go through some concussions with Jamie, just to check and make sure there's no build-up of any fluid or anything in his lungs. So what I'm going to do is just put 2 fingers on, and then just give him a nice tap, and I'm just looking for a normal resonance. I don't want any dull noises, because that indicates maybe a build-up in the lung itself. So I'm just going to go through, do that on both upper lobes, one side. And we'd obviously do that on the back as well, but there's no deviations there on Jamie at all. We'll go through now and do some auscultations as well, so just do a bit of listening through the stethoscope, just see if I can hear anything, any problems. It's really important that we just clean it off first, just so the patient and me don't pick up any sort of infection. And then these are facing forward, just so they go straight into my ear canals. And all I want to do now is just stay nice and relaxed. Okay, so I do this, just breathe nice and normally and slowly, okay? So obviously there's no noises or anything there, nothing untoward, but you'd obviously go around and do every lobe and make sure that you can't hear any crackling or any noises that suggest any build-up inside. And that's it for the cardiorespiratory assessment.